My children have been wondering if really theater nursing is the same as ward nursing because they think I struggle a lot and I come back home very exhausted. And sometimes when cases overrun, I arrive home very late. They were thinking, Mom, these questions have come like, Mom, would you rather work on the ward and see the difference because you're very exhausted when you come back home? But I try to explain to them that nursing is nursing. You're dealing with lives. It doesn't matter where you work. You will always be exhausted if you commit your time to caring for patients. So today they've decided they'll be asking me questions. My daughter specifically is here with a list of questions. I wonder what those questions are. But she is happy to ask me the questions, and I'm going to try my best to let them know what theatre nurse really entails and what I do at work, even though they've come to work, but they really don't understand what really goes on behind the scenes. So I'm waiting for her questions, and let's hear what they have to ask. And any nurses out there, uh, I wish you could help me answer these questions because you understand the drill. Let's hear what they have to ask us. I'm answering on your behalf.
Mommy, are you ready for the questions?
Oh, yes, baby, I'm answering. I'm ready for your questions.
Congratulations, Mommy, for the work that you do. We know you work hard and we know that, but still we're left with questions and we believe that you can answer them today. So, why theatre nursing and not why
Why theatre nursing
and not ward nursing or
and
even
not
clinic?
ward nursing? Although I have experience in working on the wards, I chose theatre nursing because it is better and it suits my skills, strengths, and professional interests. And that is why I am a theatre nurse.
How do you find theatre nursing? I've come to your workplace and I can say it's a very closed environment.
Yes, I know you have come to my place of work. Both of you actually have been there. And actually, it's an enclosed place. But theatre nursing requires precision, organization, and attention to detail. So I perform best in structured settings where every action has a clear purpose and timing is critical.
Are you directly involved in surgery? If so, what do you do?
Oh, yes, every theatre nurse is involved in surgery directly because how would the surgeons operate without theatre nurses? Theatre nurses prepare everything for patients that is needed for surgery so that the surgery is successful and the care is given. So I enjoy in theatres. I am directly involved in patient care during surgery by scrubbing, circulating, and assisting the surgical team, and allows me to contribute on a hands-on and meaningful way.
How many people care for a patient at a time?
Well, it actually depends on the type of surgery that the patient is having. There are some surgeries that require a lot of people in the theater because you'll have other professionals, like if you're doing a open heart surgery, for example, you'll need perfusionists. If you're doing a case that involves different specialties in surgery, then you will need, if it's involved plastics, neuro, and max fax, they will all be there. Like in a trauma theater where I work, trauma theater, you might find that there's a patient being operated on by neurosurgeons, plastic surgeons, and someone's opening the abdomen, someone's opening the head, and the orthopedic surgeons are working on the leg to stop the bleeding. So it depends on how many procedures need to be done and how quick they should be. So theaters basically has a strong teamwork and communication. Theaters rely heavily on trust and contribution and clear communication. I value working closely with surgeons, anesthetists, and other theatre staff towards a shared goal.
How do you make sure patients are safe while in surgery and when they're asleep?
The most important thing that I should tell you is safety is paramount for all patients. Every patient who comes in must be looked after. We have a responsibility, and especially theatre nurses, we are the advocates for these patients when they come to theatre. So patient safety is paramount. From instrument count and maintaining a sterile field, theatre nursing places patient safety at the forefront. I find this responsibility both challenging and very rewarding, especially when patients leave theatre and they go to the wards and then we hear that they're discharged home safely.
Is there a way you follow up on patients when they're back on their wards?
Well, I will say no. For theatre nurses, we actually don't follow patients back on their wards, but surgeons follow them up. Sometimes we get feedback from surgeons. But the continuity of care at a critical moment is done by the ward nurses. We do care in the theatres, but while ward nurses involves ongoing care, theatre nursing allows me to support my patients at a very vulnerable point in their lives. Being able to reassure patients before surgery and advocate for them during the procedure is very important to me. So we talk to these patients when they come to theatre before surgery, and we reassure them that we are going to do our best for these patients.
I imagine there is a lot of pressure, especially when people's lives are on their, especially when people's lives are in your hands. How can you cope?
The pressure is actually real. The pressure is actually real. And most everyone who works in theatre, from the healthcare assistants to the surgeons to anesthetists and all theatre staff, are under pressure. We all work under pressure. Theatre settings can be fast paced and high stakes. I remain calm, focused, and effective in the situations, which helps the team to function smoothly. And everybody tries to be calm and function smoothly.
Do you one day hope to move higher in your career?
Do I hope one day to move higher in my career? I'm not very sure about that, but yes, if it comes, I will move. I think professional growth and skill development is a must for all of us. Theatre nursing offers constant opportunities to develop specialized skills and knowledge across different surgical specialties, which keeps me engaged and motivated. So, yes, one day I might move up the ladder. I will consider that.
Would you go back to the wards in the future?
I actually did not see that question coming because you guys are aware how much I love theatre. When I think about it, after working in both settings, I have realized that theatre nursing is where I can deliver the highest standard of care while remaining professionally fulfilled. And that is me. There are people who love working on the wards, but for me, it is the theatre, and I love working in theatre. So I don't think I'll move to the ward. Sorry.
Mommy, are you ready for the bonus question?
Oh, yes, there's a bonus question. I'm terrified what that question is, but yeah, bring it on.
What are the pros and cons of being a theatre nurse?
Wow. Questions on theatre nursing aren't complete without that question. And I think that's the biggest question you've asked. Because let me start with the pros.
Yeah.
Yeah?
Yeah.
Is it better to start with the pros than cons?
Than the cons.
Theatre nursing is very satisfying. You see patients coming and leaving after you've sorted out their problems. They come when they are very worried, terrified, fear of unknown, but we do speak to them before the surgery and we try to encourage them. And this makes the situation even better for us who work in theater when a patient is calm and composed. So we try talking to them, and that is why you should know the type of procedure and know the treatment the patient is having so that you're able to communicate with them. So a lot of times when we talk to patients, we calm them down. Even mothers who bring their children to the hospital for surgery, we calm them down by talking to them. It is also our duty to ensure the patient understands what they are going to go through. And if you have somebody who is very nervous, the person who should be helping them is the theater nurse, because we are trained. So after reassuring patients, patients are usually very calm. And when they wake up, they actually remember that you spoke to them and you made them very calm at that time. And they don't forget. They always remember that nurse. If at all it's a procedure, they come the second time, they always remind you, oh, you were there during my last procedure. But normally nurses may not remember, the theater nurses may not remember the patient because the operation is done and they go. But when they come back, they remember your face and they remember the good things that you do. And that is why it's important that when you're doing something, do the right thing that they'll remember positively, because they could identify you if you did a wrong thing or you were not nice to them as a nurse when they come back. And they'll point at you and say, I don't want that nurse. And it is their right to say that. So it is very fulfilling to see patients coming back and telling you, well, you helped me. Like, for example, I was in a theater for cesarean section one day and I never saw this patient. There was a bleeder, but I was encouraging them. So she saw me on the bus. I was so surprised when she called me, Sister, how are you today? I was bleeding another day and you encouraged me. And she was with her lovely baby. I could not even remember. And she introduced me to her husband. Do you remember her? And the husband said no, but she could remember me because I was encouraging her. Remember, cesarean section is done when patients are awake. So she knew exactly what was happening. And I felt so good. And that encourages me to talk to patients and just encourage them, because they're desperate for someone just to give them that support. So as a nurse, it's important to give that support. And other pros is when you see a patient coming back to the clinic, they pass through the theaters to say hello to you, and you see, okay, you're okay, they are fine, they are happy, and you just also feel happy because of what you did. Like, for example, in trauma cases, there are cases that come very, very bad. But in the end, you hear that they've even woken up and have been discharged, even when they've come from ITU. And that is a good result. And you know that you've done your best. The cons: theater nursing can be a bit stressful and it needs a lot of sacrifice. For example, if you start a long case, a long surgery that you cannot stop because maybe you are busy saving a life, an open chest, a craniotomy, opening of the head, you're not going to stop to go to the toilet. And so a lot of times you find your bladder is so full and you just continue pressing on until a time when you can move out and go to the washroom. So that is one of them. Sometimes we go for long hours without even stopping the surgery, which means if you're not stopping the surgery, you're not going to eat anything. So you're hungry until you forget that you're hungry and feel no hunger anymore. And that is being a theater nurse. And all theater nurses can tell you this. Even ward nurses, I believe, have this. In theater, again, long-standing procedures. Long-standing procedures where now the legs, the circulation doesn't really happen well on your legs. And you find some of the nurses get deep venous thrombosis because they're just in one place for 8, 12 hours trying to save a life. It's a lot of sacrifice. We move a lot with instruments. They're heavy. And sometimes you find people, because you are always transferring a patient from the table to the operating table and back to the bed, and from the bed to the operating table. So because you're always transferring, many nurses have back pain. People have back pain that they are working, but they still have back pain. So those are the cons. But we still love the job. We are not leaving this job. We are here to stay. Maybe retirement is what will keep us out of this theater. We will still be theater nurses. We will still do the job. We'll still keep our bladders full to save lives. We are still going to ignore our lunch breaks and save lives and smile after work. As you walk home and you know you saved a life, you feel so good. You reach home and you're so exhausted. And on the other reason why the children now are asking me these questions is sometimes I come home shattered and I come home late and they wonder, what have you been doing? Mommy, this nursing. My neighbor who is a nurse comes home early because she works on the clinic. So they do not understand how I come home late. But now I know they believe, they know that we save lives. We're making good stories out there, especially in my hospital. There's a lot of life saving because it's a major trauma center. There's nothing we haven't seen. People there work, and I love it. I would go without emptying my bladder, and again, I'll go without my lunch if I know I'm saving a life.
Well, thank you, Mommy, for taking your time to make us understand this career and what you do. We know how much you're committed of your work, and we pray for God's blessings among you and your colleagues. Continue saving lives, Mommy. We love you and we're proud of you.
I love you too, baby. Now I hope you understand what I do. And I am proud that I save lives. When I walk out there after saving a life, I feel good. Even if you see me coming back home late and exhausted, in my heart, I am so happy. And thank you for taking time to understand my profession.
You're welcome.
And God bless you too.
Okay,
Thank you for watching. Sorry.
Guys, make sure you subscribe to my mom's channel. Make sure you like,
Yeah,
subscribe, and
subscribe,
turn on your
subscribe.
notifications and stay tuned. Bye.
Thank you. And sorry, she's not ready to bring her face to the camera. And that's why I keep turning my head to speak to her, because I'm responding to her. Next time, she might probably just appear. She might make a sneak peek into my video. But thank you for watching. And do pray for the nurses. And nurses out there, continue doing the best jobs that you do. Goodbye.
Bye.